Hello, I am Associate Professor Dr. Hasan Ersöz. I developed the Ribella procedure for you in 2024. Now I will move on to explain the details. The Ribella procedure is actually a response I developed based on the requests of our patients. Several of my patients had previously applied for corrective surgery for rib flare deformities that we had been treating. But one day, I received an email from a patient asking if I could remove their ribs. We requested photographs of the patient but could not see any rib flare deformity. When we asked him why he wanted it, he said he wanted to have a narrower waistline by removing the last two ribs. After receiving notifications from patients, we hesitated to remove ribs. These ribs protect kidneys. Because the purpose of those ribs is to protect the kidneys, or spleen, liver, and other internal organs from various traumas. We thought about how we could achieve this without removing them, and even from an aesthetic perspective, how we could do it seamlessly without any incisions, while also considering the patient's comfort and ensuring it would be pain-free. And we designed the Ribella procedure. We addressed all these needs with the Ribella procedure. How is the Ribella procedure performed? We shape the ribs through special procedures done through a few holes the size of a bee sting, or in other words, needle-sized holes. And to maintain the shape, we fit the patient with custom-made 3D corsets, which helps keep the patient's chest in this position over time. After about 2 months of using these corsets to ensure stability in the patient's chest, we then free the patients from the corset and create a groundbreaking appearance that results in at least a 7 centimeter reduction. Actually, our goal is not just a reduction in centimeters. Achieving a curvy shape, specifically a waist curve in women that resembles a Turkish hourglass. Is it only for women? No. This procedure is also a significant necessity and demand among transgender women who have transitioned from male to female. Similarly, we thought about whether we could apply this procedure for the treatment of rib flares at the front, and successfully implemented it with our patients. No stitches, no pain, no incisions, and no removal of ribs or any organs. If patients have concerns about the future, such as pregnancy, they don't need to worry at all. After 2 months of using the corset, the patient heals all their tissues and feels as if they have never had surgery. Who is the Ribella procedure more effective for? It's not really for obese, fatty individuals. We recommend that they first undergo liposuction or lose all that fat through exercise. Our goal is not just for them to exercise or be fit or have a low body fat percentage, but rather to avoid a square shape. It's related to individuals with a narrow waist circumference. This is a genetic inheritance. Some have small ribs. Keep looking good. But people with wide ribs can't look narrow. Only Ribella can help. But individuals with a wide rib circumference, no matter how much they lose weight, can never achieve that narrow look. The only way to achieve this is to undergo the Ribella procedure. We can compare this to rhinoplasty. The only way to achieve this is to undergo the Ribella procedure. We can compare this to rhinoplasty. A person with a crooked nose cannot achieve the look he or she wants no matter what he or she does. Because if the only solution is rhinoplasty, then for individuals who genetically have thicker features, the only way to achieve that look is to undergo the Ribella procedure. As the team that brought the Ribella procedure to the world, we are happy and proud. We invite you to our clinic with the slogan, "Shape up with grace, no pain, no trace." In other words, we are waiting for you at our clinic saying, "Take shape gracefully. There is no pain, no scars." We wish you all healthy days.